Hi, I'm Dr. Mache, and you can find out more about me at drmache.com. And you are here listening to an interview on the Hot Years. That's a magazine that is for women that helps them get insight, inspiration, and information in and around menopause. One of the things that's one of the most common conditions for women in this demographic, and actually for a lot of women, about 5% of women, is thyroid disease. And nobody better to talk about that than Dr. Izabella Wentz. Let me read a little bit about her. She is an internationally acclaimed thyroid specialist and licensed pharmacist who's really dedicated her career. I've known her for about 5 years or so, maybe a little bit longer, and she is a hardworking, dedicated lady in this domain. She herself was diagnosed with Hashimoto's thyroiditis in 2009, and there's nothing like getting real up close and personal with a condition, having it kind of fumbled around with for a while, and really having to get your own shovel and dig your way out to find something that's a little more clever and a little more innovative than what she was being given. And that's basically the background for this. And I would just say that most recently, she had a #1 New York Times best-selling Hashimoto's Protocol. That's the name of the book, Hashimoto's Protocol, a 90-day plan for reversing thyroid symptoms and getting your life back. She speaks internationally and locally. She is a teacher for patients and for practitioners and has really done a lot of work, training, and writing in this domain. So, Izabella, how lovely to see you, and thank you for joining me.
It's always such a pleasure hanging out with you, Mace. Thank you for having me.
My pleasure. And, I've already kind of spilled the beans about how you got interested in thyroid disease, but I'm going to hop into, how common is this problem? How big a deal is thyroid disease?
My goodness, it's incredibly common. Based on the current statistics, we're looking at anywhere from 13% to 28% of the U.S. population when we use more advanced diagnostic methods. And if you use the old school diagnostic methods, you're probably only going to come up with 1 to maybe 2% of the population. Mm-hmm. And so really the case is we probably have at least 40 million people with this condition that are walking around and they're not aware that they have it.
That's a lot of people. And in thyroid, of course, the thyroid gland is, a butterfly gland on your neck, but it's not so little in terms of its impact. What does the thyroid actually do?
So it manages our metabolism, and it has this important role of providing hormone and management and driving all these processes within our body. And actually there's thyroid hormone receptors in virtually every cell in our body. And so when we're deficient in thyroid hormone, we end up with a whole host of symptoms. With thyroid conditions, the most common one is going to be an underactive thyroid. Generally, we're thinking we're going to have problems with metabolism and energy production. So the person can become more sluggish, where they become more tired, their mental functioning becomes more sluggish, so they're having problems with remembering things, they're having brain fog, they're having potentially depression even, and then they're also going to see a big impact on their weight. So many times we'll see that women who get diagnosed with the condition won't be able to lose weight, or they'll continue to gain weight. And another function of creating metabolism and energy with the body is heat production. And so a lot of times we'll see that people with the condition tend to be on the colder side, or even that they're not able to properly manage their temperature, their body temperature. That's what the thyroid does, is it manages our metabolism. It's sort of the thermostat for our body, and it has an impact on energy production. So we'll see people will have a lot of symptoms across the board, whether that's having a slowed metabolism where they're gaining weight, or they're having an inability to manage their emotions or even regulate their body temperature.
Well, it sounds a little bit like menopause, doesn't it? Many of the symptoms are overlapping, and of course women in menopause are a little bit more susceptible, seems to catch women at that time a little bit more often than it does when they're younger. And of course, I think there's another symptom that I see associated with very often, and that has to do with skin and hair. Could you comment about that?
Absolutely. Yeah, absolutely. And as you mentioned, menopause is one of the peak times when a woman might get diagnosed. Pregnancy, puberty, perimenopause seem to be the most common times. With effect on skin and hair, this is going to be one of those things that I know for a lot of women can be very distressful. They might have hair loss. Their hair may become thinner. Their hair may look like it's more damaged and maybe more difficult to brush, less manageable. And then we'll also see changes in the skin. So generally the skin is going to be more dry and maybe more prone to breakouts. And we can also see that, some women have reported that it just seems like they've aged overnight as a result of thyroid disease. So those are some of the common factors. And I know for a lot of women, those might actually be the driving factors why they might go see their doctor. So they might be tired, but everybody's tired. But as soon as that hair starts falling out, that's a really important signal that there's something going on within our bodies that's not supposed to be going on, right?
Right. Of course, that's not the only reason women have hair loss or changes, but it's one of the most common, and it's one that could be a clue. Now, you mentioned earlier that some testing will only give you a 1 to 2% diagnosis rate, but that other kinds of diagnostic testing could increase that, the ability to figure out that it's a thyroid condition. And this is where there's a big divide between different doctors' practices and different beliefs and what's the best way to work it up. But I wonder if you could share, you've had a lot of experience with this, I wonder if you could share, if you were going to see if someone had a thyroid problem, is there a first round of testing? Is there then a second round? How do you go about it?
Sure thing. And generally, if you were to go to your doctor and ask for a thyroid test, the TSH test would be done. And that would reveal
stimulating hormone.
Exactly. And that's a wonderful test, and it'll find many cases of advanced thyroid disease. Now, the challenge is that most doctors will not run additional tests unless the TSH is elevated or suppressed. Right. And another challenge is when the reference ranges were first determined for the TSH, there were people within the pool of blood that was used to determine what was normal that actually had thyroid disease. So the reference range was overly lax. So those are two of the big challenges. And another...
excuse me. So you were saying that when they established what's a normal value for TSH, the blood samples they tested, some of the people were normal and some had thyroid disease. Is that what you're saying? Or some of them had different degrees of thyroid disease. So that range, it's kind of funny because they were sampling from a large range of tests in order to decide what was normal.
Exactly. So people in the sample of blood that was qualified as normal were actually there who had thyroid disease. And so the reference range was overly lax. And so I know back in the day, the reference ranges were, okay, if you have a TSH as high as 8, as 7, as high as 5, you were considered to have normal thyroid function, when most people generally feel best with a TSH between 0.5 and 2. Of course, there may be outliers. The associations of endocrinology and various types of internal medicine associations have changed the reference range and made it smaller now, but not all of the lab companies have complied. Some of them have started complying. So we're going to see that the reference range is a bit smaller now, but still, another challenge with that test is that the TSH may actually be normal for the first 5, 10, 15 years that a person has thyroid disease. This is because there are 5 stages to thyroid disease, and in the very first stage, you have the genetic predisposition. The second stage, you have the attack on the thyroid glands. The third stage, you have slight changes in TSH. The fourth stage is when you have significant changes in TSH, and usually that's when most people get diagnosed, is in the fourth stage. So, to back up a little bit, the more advanced diagnostic testing that can be done are going to be thyroid antibody tests. Mm-hmm. And thyroid antibody tests, they are TPO antibodies and TG antibodies, can reveal if there's an autoimmune process or autoimmune attack that's directed at the thyroid gland by our own immune system, which then results in thyroid symptoms.
Tell me what the TPO and the TG stand for.
Sure, of course. And for anybody listening, I would just recommend getting a pen out, and you can abbreviate it, but thyroid peroxidase antibodies and then thyroglobulin antibodies. And, if you ask your doctor, you can just say TPO antibodies and TG antibodies. Don't try to spell it out and butcher it. But if you like medical terminology, you can write out the full names.
Great. So if they get a TSH test run and a TPO and TG antibodies, that would give you a pretty good clue. And if the antibodies were positive and the TSH, even if it was considered normal by the test range, which many times is up to 5 or 4.5 or 5, and you're saying between 2 and 5 could be already in the abnormal or early abnormal range. So that combination might be an indication to treat.
Absolutely. And so we're looking at thyroid antibodies. And thyroid antibodies have been correlated with symptoms. So women and men with thyroid antibodies will report symptoms like anxiety, fatigue, weight gain, a lot of these other, even depression, a lot of these other symptoms that could be caused by low thyroid function, and actually the antibodies can play a role in our symptomatic profile independently of the thyroid of the TSH or how much thyroid hormone you have circulating. And so some research has actually found that starting treatment when a person has thyroid antibodies, maybe a tiny dose of thyroid hormone may be beneficial. I'm a pharmacist, and so of course I love optimizing thyroid hormone medications, and proper medication use is a big exciting thing for me. But I also really encourage women who have these antibodies and maybe they're not quite ready for thyroid hormone medications to start thinking about lifestyle, because lifestyle is a really, really big, important factor to utilize when you have these elevations, and that can actually prevent the need for thyroid hormones in some situations.
So when you talk about lifestyle, you're talking about, for me, lifestyle is many things, but 4 things in particular. It's sleep, it's stress, it's nutrition, and exercise. Those are 4 important lifestyle things. What are you talking about when you talk about lifestyle things that people can do?
Yeah, so specific lifestyle things for people with Hashimoto's, for thyroid disease. And I should just mention that probably 95 to 99% of people with thyroid, an underactive thyroid, likely have Hashimoto's, and maybe just not know about it. But what I found is some of the most common triggers and some of the most common positive lifestyle changes is nutrition. So adjusting your diet. 88% of people with Hashimoto's feel significantly better on a gluten-free diet, 80% feel better on a dairy-free diet, and somewhere between 60 and 70% feel better on a soy-free diet. And getting off of these 3 foods when you have Hashimoto's can actually, as a pharmacist, this is a big deal for me to say, can actually produce more positive symptom reduction and better improvement of quality of life than even using thyroid hormone medications for many people.
So getting rid of gluten, soy, and dairy are 3 important things to consider if you're dealing particularly with an autoimmune, which is, where the body is kind of making attacking some of the cells, in this case the thyroid hormone. So if you have that, those 3 things would be helpful. Other lifestyle things that you would recommend, or?
Yeah, so nutrition, going a little bit deeper on that, I like to utilize nutrients. There's various nutrients that can be deficient in thyroid disease, and they can be an exacerbating factor or triggering factor. Selenium deficiency has been identified as a trigger for thyroid disease. So utilizing selenium 200 to 400 micrograms a day can reduce thyroid antibodies, reduce anxiety, improve and reduce some of that hair loss. And then thiamine, 600 milligrams a day or so.
Thiamine?
Thiamine, yeah. It's something we typically think of being deficient in alcoholics, but trust me, you do not need to be an alcoholic to have a deficiency. It's just people with thyroid disease and Crohn's disease are found to have subclinical deficiencies of this important vitamin, and restoring this vitamin can actually help a person's energy levels in as little as 3 to 5 days. And then another vitamin that's nutrient that's helpful is going to be magnesium. So a lot of times women might have joint pains or cramps or constipation, headaches. Magnesium citrate at bedtime is something that can be very helpful for many people with thyroid disease. And then there's additional tests that
is that 2 to 400 milligrams? Excuse me, like 2 to 400 milligrams, or how much do you suggest?
Yeah, generally I would recommend for magnesium citrate to look at the bottle and then look at what the recommendations are on the bottle and start at the lower range. So just starting off with one capsule and then seeing if you need a little bit more.
Yeah, because mag citrate can, in higher dosages, cause a little bit of diarrhea potentially or cramps. So less is more there.
Less is more there. In some cases, in people who have constipation when they have thyroid disease, because that can be, of course, a symptom of thyroid disease, the little bit of propensity of magnesium citrate to move the bowels can be beneficial for them. But generally, we don't. We want them moving, but we don't want them moving too quickly.
We don't want them running. We just want them moving.
Exactly.
Got it.
And there's additional few tests that I like to see people get with their doctors, and that's going to be vitamin D, ferritin, which is the iron storage protein, as well as vitamin B12, to see if you need further supplementation with that. Now, these nutrients can help with balancing your immune system. They can help with getting your energy levels up, and they can also help with the digestive process and hair loss. So these are 3 that you wouldn't want to necessarily supplement on your own. You would want to test with your doctor because there are some vitamins that are water soluble that we can utilize safely, and then we pee the rest out, and then there's some that can build up in our system.
Yeah, the fat soluble vitamins are K, A, D, and E, and those can build up in your body in the fat, and the other ones, if you get too many, kind of just pee it out. That's what you're talking about.
Yeah, and so vitamin D would be that, and then of course with iron, people can be iron overloaded, and then you can have iron as one of the most common overdoses for people.
For supplements.
As supplements go. So you don't want to just take it willy-nilly. You do want to see where you are. You could have not enough of it, you could have too much of it, or just the right amount.
Now, when you do get different kinds of treatments with medications, there's a lot of discussion about what kind of thyroid to use. And this is a discussion that goes on in the sort of the functional medicine and the more naturopathic doctors versus the allopathic doctors. Most of the times, if you go to a regular endocrinologist, you're going to get Synthroid for thyroid, or something that is a T4 derivative or medication. What are your thoughts on, options for this, or how do you feel about which thyroid medication might be one to consider?
I think T4 is a wonderful medication. It is the same hormone that we have in our bodies, and it works really well for many people. However, there are some people where it just doesn't work for them. T4 is actually considered a prodrug because it needs to be activated to a more active version inside the body known as T3. So T4 has some activity in our bodies, but T3 has more activity in our bodies. And T3 I kind of call the go thyroid hormone because that's what creates beautiful shiny hair, gives us energy, and really has a profound impact on our metabolism. And so on paper, T4 to T3 gets converted, no problem, right? But in the human body, this doesn't always happen, and this could be because of genetic mutations, nutrient deficiencies, this could be due to stress, and there's a whole host of various factors that can prevent this proper conversion. And so we see that for some people, they get on T4, and they don't feel any different. They say, my head still feels like it's detached from my body. I don't think this is how I'm supposed to feel, right? Their numbers look fine. Their TSH looks fine as far as their thyroid labs go, but they don't feel fine. And in that case, they may benefit from taking T3 directly. And you can do that with either a medication like Cytomel that's added to the T4 treatment, that's a standalone T3, or using a natural desiccated thyroid that contains T4 and T3 isolated from the thyroid glands of animals, or you can utilize a compounded T4, T3 formulation made by a compounding pharmacist. But all of these different medications have their advantages and disadvantages. And with the natural desiccated thyroid, we may see that a person, if they're a vegan, they may not want to utilize the glands of a pig, right? But so that's a disadvantage, and where compounded medications may be more appropriate for them. And compounded medications, they take longer to prepare, and they have to be made by a specialized compounding pharmacy. And so there's a lot of different considerations, and I would say it's not like a one-size-fits-all approach, and I really advocate for patients to work with a doctor practitioner that knows how to utilize all of the medications, not just one of them, right? A lot of times they'll say, okay, well, my doctor won't prescribe natural desiccated thyroid, or they won't prescribe T3. How do I convince them? And I'm like, you don't want to be their first patient on a drug, right? Like, you want to go to somebody that knows how to utilize all of the different ones.
And then for their testing, to follow them up. I mean, some of the testing is going to be actually, how do you feel? Because you do symptomatically get to appreciate differences in how people feel within not that long a period of time. May take 3 weeks or something like that, but usually 3 weeks or 4, you should see some difference, right? In how people feel.
Absolutely. Yeah, absolutely. We're going to see stability in about 4 weeks when the drug starts to stabilize in the body. And at that point, the person should start feeling better. At about 4 to 6 weeks, they should get their labs drawn again. And an important consideration, too, is you want to make sure that if you're taking T3, you actually do your lab first, your thyroid hormone function testing first, before you take your thyroid medications. Because if you take your thyroid medications that have T3 and then do your labs, you may come out with lab results that show that you have too much thyroid hormone when you're in the normal range, or that you have the normal range of thyroid hormone when you don't have enough, because of the way that the medication is metabolized in the body and the way that it releases.
So you need a before and then during treatment at intervals of time. Maybe in 3 months you check in again, or 6 months, to see how your levels are coming. So you know what's going on. I mean, it has to be an ongoing thing. You don't just take it once and you're done. You have to evaluate it as an evolving work in progress. And also, people's needs change. One of the common things that I see is people are on thyroid hormone and they're very well managed, and then they start through menopause because it's all happening around the same time, and then they go on hormone therapy. And the hormone therapy, by the way it works, can affect the levels of thyroid hormone that are available in your body. And it's not anything that's a problem. It's just you have to be aware of that and realize if you adjust your hormones, estrogen, in your body, then you're going to adjust the need for a thyroid medication. Just be aware of that, because if things get kind of funky, it's just an adjustment problem. That's all. And it's normal. Just realize it.
Mm-hmm. Yeah, any kind of changes in how you feel, new health conditions, menopause, more estrogen, less estrogen, various medications that you may be taking. Right. These are all things that can impact how your thyroid hormone is working in the body. And I actually do recommend periodic testing. If you're stable, every 6 months to 1 year is fine. If you're having those thyroid symptoms, then you're going to want to test more frequently, maybe even every 4 to 6 weeks until you get stable.
I want to take just a couple of minutes because we'll conclude before too very long, but I want to just take a couple of minutes to talk about the impact of stress and gut and things that could impact. So would you mind spending just a moment on each of those?
Of course. So some of the biggest triggers are going to be toxins. We're going to have an impaired stress response.
When you say toxins, give us an example of a toxin.
Sure. So some toxins like mercury have been found to trigger or exacerbate thyroid disease. We also have toxins in our day-to-day environment like fluoride in our water supply, We have triclosan, which was in our antibacterial soaps and was recently banned by the FDA. That can be potentially contributing to because of thyroid dysfunction. And then also toxins that are present on flame retardants in mattresses. So this has been a recent study. A lot of recent studies have come out on this about the impact of these on our bodies and our thyroid function. So these are some examples of toxins, and they can damage the thyroid gland and cause an autoimmune response.
So the environment can affect you indirectly by all the fish you eat from the mercury that's gotten in our oceans, and it can affect you more directly through the flame retardants and through different substances that are in water and other foods that we ingest. So just have to be mindful of this. And it's kind of hard because you have to be thinking, you have to be your own advocate and have some level of awareness in all of this, because these seemingly small and common things are not the things that often get talked about, yet they can play a big role in your health, and that's what you're saying. What about the gut and any inflammation in the gut or other things that you think? Because, you know, a lot of people hear it, but there are many schools of people. Some people are aware that there's 3 pounds of bacteria in your intestines that are doing their thing, and other people say, what? So maybe you could just comment briefly on that.
Sure thing. So every case of Hashimoto's is related to intestinal permeability or impaired digestive process, and so we find people will have a lack of digestive enzymes, they will have potentially infections within their gut, they will have food sensitivities, and they may also have an imbalance of gut bacteria. And all of these different things can actually set the immune system to be more hypervigilant and to attack the thyroid glands. And so getting the gut in balance is going to be a key component of restoring thyroid function. Kind of interesting, but fetal cells, gut cells and thyroid cells have the same fetal origin, and it just, you know, I would say it's very evident to me whatever we do to help our gut will help our thyroid and vice versa.
So this is back to, you know, the ingestion of which foods, and you were talking initially about gluten, soy, and dairy are things to be mindful of, but there's a whole lot of things that we shouldn't be eating for in terms of our intestine and intestinal bacteria, just in terms of processed foods and too much sugar and a whole lot of other things. I don't want to keep you too long, but I would like to ask you if there's any final things that you would like to wrap up with, you know, in terms of points to take away.
Now, stress is something that is a huge trigger for people with thyroid disease and for any kind of chronic illness in general, and one of the biggest ways that we stress ourselves out is by not getting enough sleep. And so one of the recommendations I have is to actually sleep more. So that's one of the greatest things that a person with thyroid disease can do to help themselves feel better is get more sleep and work on their stress response. So whether that's taking up a stress relief hobby like yoga or knitting or gardening, whatever the case may be, finding that opportunity for you and for yourself to put your body in a rest, digest, de-stress, and heal mode is really going to go a long way for you.
Oh, I like that. Arrest, de-stress. What was the third one? Arrest, de-stress.
Digest and heal.
Digest, yes. In heal mode. Well, I want to thank you very much. Dr. Izabella Wentz is the author of the New York Times bestselling book, The Hashimoto's Protocol, a 90-day plan for reversing thyroid symptoms and getting your life back. I think it's an important contribution because thyroid disease affects so many people, and it has a tendency to affect women more than men, and particularly women who are entering into and in menopause. It's a time where the symptoms can be confused with menopause symptoms. So as part of your evaluation for your menopausal symptoms, that's always something worth being aware of and talking about with your doctor. You can have two things, you know. It doesn't have to be one or the other, but the tipping point can come when one thing affects the other. So I'm your host, Dr. Mache Seibel. You can find more at drmache.com, drmache.com. And if you're interested in learning where you are in menopause, you can find out more by taking Menopause Quiz. Go to menopausequiz.com. And Dr. Wentz, if people wanted to get in touch with you, or there's things they wanted to find out, some of the many resources you have, how would they go about that?
Sure thing. So thyroidpharmacist.com is the best place to find me. And if they go under gift or thyroidpharmacist.com/gift, they can have access to the chapter on nutrient depletions and deficiencies and a diet quick starter guide, as well as some recipes to get them started on their thyroid journey towards better health.
Thyroidpharmacist.com. Is that correct?
That's correct.
Awesome. Well, I want to thank you for being with me. I'm Dr. Mache Seibel, editor of The Hot Years. Remember, it's better to stay well than to get well, so stay well. Thank you, Izabella.
Thank you so much.